Hi, I'm Dr. Sam Dunn and welcome to Palm Clinic, where it's our focus to restore confidence and comfort at every step. We are located at 139 Remuera Road. This is on the corner of Remuera Road and Dilworth Avenue at the foot of Mount Hobson. We have parking available in our driveway. It pays to arrive 10 minutes early for your initial appointment to fill out paperwork. For your ongoing appointments, if able, we encourage you to park in Remuera Village and walk to your appointment. This increases the size of your veins so they are more easily visible on ultrasound, which will enhance your end result. Our vein care team will greet you at reception and give you necessary paperwork to fill out. As we are affiliated with Southern Cross, if you are a member, please bring your membership number. The following slideshow describes normal vein function, abnormal vein function, and how we correct it. So in your leg, you have your deep veins, and these are responsible for draining 90% of the blood up the leg. This smaller one here is your surface vein, and it's only responsible for 10% of the drainage. If it's not working properly, you can do without it. This is one of the veins that you would recognise as a varicose vein in your leg. The calf muscle works as a pump, and when you walk, it squeezes the deep veins and pushes the blood against gravity up the leg. The valves open up to let the blood move up. When the muscle relaxes, the valves come back and meet and stops backward flow of blood. In a good leg, the valves should be meeting in the deep veins and in the surface veins. When you have varicose veins, the surface vein, the valve has become faulty and now you have backward flow in that vein. This results in pooling in the vein, which can explain your symptoms of aching, heaviness, throbbing, and maybe swelling. If you are suitable after your ultrasound, the best treatment is radiofrequency ablation. And this involves feeding a small fibre up the inside of your vein, surrounding it with local anaesthetic, and then firing the fibre as we withdraw, resulting in closure of the faulty pathway. Once that faulty pathway is closed, you're just left with the deep veins draining the leg, which results in improved drainage of your leg. Ellie, you'll next meet one of our specialist vascular sonographers for your ultrasound mat.
Hi, I'm Nikki. I'm one of the sonographers here at Palm Clinic, and I use ultrasound to look at the veins in the legs for your treatment of varicose veins. We look at the deep veins and the superficial veins. The deep veins are the main source of drainage in the leg, and we just check to make sure that these are normal. And the superficial veins, which are the veins responsible for the varicosities, are documented on our map, and we refer to this map each time you come in for treatment here at the Palm Clinic. The examination itself takes approximately 45 minutes. The ultrasound doesn't hurt at all. We use some nice warm gel here, and that helps glide the probe up and down your leg when we're looking at the veins.
Next, you can book your treatment based on the ultrasound findings.
Okay, Alison, now I'm going to talk to you about what to expect after your treatment. Whether you have radiofrequency ablation or ultrasound guided sclerotherapy, you will be fitted with a pair of below-knee compression socks that you will wear for a total of 2 weeks. For the first 3 days, you need to wear these full time. That means during the day, including showering, and in bed at night. For the remaining 11 days, you only need to wear these during the day, so they can be removed for showering and in bed. For the first 2 weeks after your treatment, you need to walk for an hour a day. This can be done all at once or broken into 2 30-minute sessions. And you do need to walk directly after your treatment here, so please bring comfortable walking shoes and allow for this time before driving home. Most people do not find the procedure painful. However, afterwards, you can expect to feel a degree of swelling, bruising, tenderness, and redness. This can last up to 2 weeks, but is usually manageable with simple paracetamol and an ice pack. If you find that paracetamol isn't strong enough, you can take ibuprofen as long as you have no problems with this medication. Now I'm going to talk to you about the common side effects and the rare but potentially serious side effects. Blood trapping. After treatment, the abnormal veins are closed down, leaving blood trapped inside the veins. This can make the vein feel hard, lumpy, and sometimes tender. This normally resolves over 3 to 4 months, but can take longer for the body to reabsorb and break this down. If we think this is something you will get, we will book you a trapped blood appointment. Brine staining. Brine staining can result from trapped blood. This is where the pigment leaks from the vein and stains the overlying skin, leaving a brown streak, much like a bruise. This will gradually fade over the next few months, but can last for over a year. And this is more common in patients with darker skin types. Telangiectatic matting. This is the development of tiny new thread veins and can occur in up to 10% of patients. This normally resolves in over 4 to 6 months, but if not, it can be treated with microsclerotherapy or vascular lasers. Neurasthenia. Neurasthenia refers to numbness or hypersensitivity of the skin and normally occurs in the lower half of the leg. This results from inflammation of the small nerves. This is normally temporary, although resolution can be slow. Migraines or visual disturbance. This normally occurs in people with a history of migraines and results from microbubbles travelling to other parts of the body. Symptoms normally resolve within 30 minutes. Although exceptionally rare, there have been reports of stroke following sclerotherapy worldwide.
Thanks for watching this outline of what to expect. You will have the chance to have any questions you may have answered at your consultation or your ultrasound map. We look forward to seeing you soon.